Let's be honest, the term addiction is super confusing. The uses of it are so broad and varied that it's hard to put a finger on what it even means. In society and culture, we can say, I'm addicted to these burgers, or I'm addicted to this car. Oh my goodness, I'm addicted to these nails. But I don't know if we're necessarily that much better as health professionals. We really don't have clear criteria to understand addiction. Now, to be fair, some of this is based on the complexity of what addiction actually is. Let's go ahead and take a look at a bunch of the definitions that exist to try to define it right now. So here are some of the many definitions that exist. According to the NIH, National Institutes of Health, addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. Jump to the dictionary, abnormally dependent on some habit. Another dictionary definition, the state of being enslaved to a habit or practice or to something that is psychologically or physically habit-forming as narcotics to such an extent that its cessation causes severe trauma. And then Psychology Today said, when continued use or an act becomes compulsive and interferes with ordinary life. The American Society of Addiction Medicine, addiction is a primary chronic disease. The APA, compulsive substance use despite harmful consequences. Jumping to Medical News Today, addiction is a psychological and physical inability to stop consuming a chemical, drug, activity, or substance, even though it is causing psychological and physical harm. HBO says, cannot control. Helpguide.org, published by Harvard, addiction involves craving for something intensely, loss of control over its use, and continuing involvement with it despite adverse consequences. Again, Psychology Today, condition which a person engages, for which the rewarding effects provide a compelling incentive to repeatedly pursue the behavior despite detrimental consequences. Drugabuse.gov, can't stop even when you know the drug is causing harm, so on and so forth. This is just a sampling of many reputable or somewhat reputable resources that try to define addiction. But we can have clarity through the confusion. Despite the fact that we may not necessarily have diagnostic criteria that's consistent across the board for addiction, there's a lot of very consistent symptoms and markers that we know to look out for, and also we have very effective treatments most of the time for many of the issues that arise. Let's take a look at the Premier Addiction Society's definition of addiction. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's behaviors and interpersonal relationships, in a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatments or engagement in recovery activities, addiction is progressive and can result in disability or premature death. That's the American Society of Addiction Medicine's short definition. Short definition of addiction. Amidst all of the experts that are out there, some consistent themes emerge, and those are going to be craving, it's going to be use despite adverse consequences, loss of control, and an inability to either abstain or moderate. Once we move beyond the definition of addiction, it's important to look at the fact that not all folks who struggle with addiction look exactly the same. It's a heterogeneous population. It's not uniform in every single way. So throughout the history of addiction, there have been people who have attempted to categorize, to understand types of addiction. These are called typologies. There was the pre-scientific era, and the scientific era began with E.M. Bunke-Jelinek with the Jelinek curve. Take a look at this. So, right before the Jelinek curve and Jelinek's attempts to categorize some things, Alcoholics Anonymous was hot on the trail of trying to understand what to do, especially in very severe cases of addiction. In fact, Alcoholics Anonymous was born out of helping the person that they categorized as the hopeless alcoholic. So they differentiated between the hard drinker, the moderate user, the hard drinker, and then the person who is hopeless, or the real alcoholic, as they said. So even then, even the doctor that's highly gave a thumbs up to AA at the time, worked at Towns Hospital, William B. Silkworth, talked about seeing these different types of addicts who would come in to the treatment program. Why is this important? Well, for professionals, we need to know and we need to treat the differences that exist among people. There are so many differences and also so many similarities too. And so working with a good treatment provider who's knowledgeable and who has experience in these realms is not just going to give you a cookie cutter approach. Remember, addiction is complex. We've already established that through how many definitions exist around that. So just understanding that there is a continuum of struggles that people have. Let me read one continuum from Dr. Earlywine in Substance Use Problems. First of all, there's abstinence, initiation, infrequent non-problematic use, regular non-problematic use, problems that are subclinical though, abuse, which gets into some clinical problems, dependence, and then a range of disorders, mild, moderate, and severe. So that's a continuum to think about it, but again, none of those really determine where addiction begins or ends. It's only a categorization through symptoms or lack thereof. Don't drive your lawnmower on the freeway. What does that mean? Well, so with addiction, we know it's complex, we know it's multi-layered. So we need to throw at it what is going to be effective to treat it correctly. We need the horsepower to back up the type of treatment that we're doing. So really in the professional realm, there's two types of treatment, pharmacotherapy and the behavioral therapies as well. And the first line evidence-based treatments are going to be things like CBT, motivational interviewing, 12-step facilitation, etc. So I want to encourage you, be assertive for your treatment, advocate for what you need. Don't waste time on some random treatment that doesn't have any backing, because we need to address it seriously. We know that addiction causes a high level of disability and even premature death. We need to take this seriously. So don't be afraid to ask those tough questions of a provider. And then there's also multiple additional resources that circle around those professional therapies as well, involving support and monitoring, etc. But getting a good healthcare professional on your team is an excellent start. I'm Justin K. Hughes, licensed professional counselor. I specialize in working with addictions, and I utilize CBT and motivational interviewing.